Okay, so on the medial aspect of the posterior of the adductor longus and cord-like is going to be the gracilis.
So it often gets confused for a hamstring.
Yeah.
Okay,
Because it's tracking.
This tendon,
easily
this cord-like
confused
tendon down
for
here is
a
not a
hamstring as you get closer to the pes anserine where it inserts.
Yeah.
So make sure that you understand that because it's on the
Doing
back
a nice
side
job of walking
here,
the fingers
on the
down
face,
using your
medial side
pads of
tibia,
your
this is
fingers,
not a hamstring. This
and
is the
then
gracilis. Came
getting
from the medial compartment.
closer to the knee. It's going to become fan-like as it creates
medial.
the
Now look, it's starting to go to the back side of the leg. I'm in the back side of the leg.
pes anserine tendons.
Tendon, behind the knee. Tendon. Now coming to the medial side of the tibia. Okay? So how am I going to create length in an assessment
So if we're
zone
going to
of
create
gracilis?
length
Well,
to the gracilis, then we're going to put it on stretch.
the hip's going to move up like this, as well as adduction, because I need to create length on that coxal.
Okay, so we're going to go into horizontal abduction and abduction of the hip simultaneously,
I can also start to create a little bit
and
of
then external rotation
of the tibia. Okay?
And then as you move the muscle into a lengthened position, the fingertip orientation changes to be in parallel with the fibers of the gracilis. Even though it's cord-like, having a broad palpation base with multiple fingers are going to allow you to identify altered or non-uniform lines of tissue tension. Okay, external rotation of tibia and the leg as you simultaneously horizontal abduct, externally rotate, and purely abduct the limb, dropping it slightly into a more extended position for gracilis. Okay, getting to adductor magnus. So we're going to be coming in from the medial aspect and going posterior.
The adductor magnus anterior face, or the adductor fibers. I walk my way down as far as I can. This is not huge.
And walking the fingers down as we go. Gotta get
but
deeper
that is how
here.
We palpate the anterior face of adductor magnus. Okay? Now, how am I going to create length in those fibers to assess?
Okay.
Well, much the same
So
way that
adding length to adductor magnus is going to be
make sure that I'm staying
adding length into abduction.
Okay.
But make sure that you don't lose the depth of your palpation as you transition your finger pads to being parallel with the fibers. So notice that you walk your elbow in into adduction at the shoulder if you're the practitioner.
That femur down into abduction extension.
And going into abduction and extension.
That's how I'm going to assess the adductor component of adductor magnus. You guys still with me? Wonderful. So to get to the posterior part of magnus, or the posterior face,
There we go.
I want to make sure that I know where the gracilis is. Okay, so I'm going to go back in here. Now I'm going to straighten out the leg again, just so I can ride up on the gracilis. And then I'll fall off the back side of the gracilis. And all of this now is going to be the posterior face, or the hamstring components of adductor magnus. So it's actually very superficial. Okay, so let's review that. Back into this, using my longus, falling off the back. Don't have to really go into this space because it's not there that I'm going to get the posterior face. Pull the knee into extension just so that I can feel the gracilis again. Fall off the backside of the gracilis. As soon as I fall off the backside of the gracilis, I can put the knee back down, or the foot back down, because now all of this is the hamstring component of adductor magnus. Okay? Now, fiber direction is going pretty much north-south, right? Unlike the anterior portion.
Okay, you're a bit posterior here because adductor magnus is going to be hip extensor with the hip inflection.
Now I'm in the fiber direction. Now
It's going to have almost like acting as a fourth hamstring.
That allows me to assess
Going into hip flexion. He's going to add length to the tissue.
We haven't got there yet.
And then you can also abduct the hip to add even more bias to that and differentiate it from the other hamstrings on the medial side.
Backside here, so I'm going to put the blue marker on the backside of the